Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're looking at peripheral artery disease, or PAD. It's a condition where narrowed arteries reduce blood flow to the arms and legs. It often shows up as leg pain when walking, but it can also lead to slow healing wounds and, in severe cases, risk of amputation. To help us talk about what it is, why it happens, and new treatment options, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being with us.
Well, thank you. It's a privilege.
All right, peripheral artery disease. What is it?
Peripheral artery disease happens when a plaque, a mix of fat, cholesterol, and other substances, build up on the inside of our arteries that carry blood to the arms and legs. This narrowing limits circulation, leading to pain, especially during activity. It's essentially a form of atherosclerosis that affects the limbs.
What are the different types of it, and does it have stages?
Good question, and it does. PAD is how it's abbreviated. Peripheral arterial disease usually progresses in stages. Early stage is there's no clear symptoms at all, but the arteries are already narrowing. We see that on ultrasounds. Claudication, cramping or pain in the legs when walking, those ease with rest, so it goes away when you rest. And then there's critical limb ischemia, where the severe stage is such that if there's not blood getting into the tissues, then there's constant pain and often poor healing and, candidly, sometimes tissue loss.
What are the causes?
Oh, the main risk factors, smoking, diabetes, and high cholesterol, can also be impacted by high blood pressure, your age, and family history. Over time, these factors damage the arterial walls and speed up plaque buildup.
So genetics plays a role?
Yes, ma'am. Well, lifestyle factors are major. Genetic predisposition affects how someone responds to cholesterol, blood pressure, and inflammation. Families with a strong history of heart or vascular disease are at higher risk.
What does traditional Chinese medicine have to say about peripheral artery disease?
The peripheral arterial disease can be seen as a blood stasis, slowing of the blood flow. That's stasis. So blood stasis is a condition where the circulation slows or becomes blocked. Treatments aim to move the blood and strengthen qi. Using acupuncture and herbs, you can get that back into balance. Some research even suggests combining TCM with standard therapies that improve circulation and healing.
How do you diagnose peripheral artery disease if someone comes into your office?
We begin with an ankle brachial index, where you take the blood pressure in the arm and the blood pressure in the lower leg and see what is the ratio. You compare that blood pressure in the ankle and the arm, and it's very simple. You can track it. And you can also use other imaging tests like ultrasound. We have that in the office, and it's very easy to see that. We send out a CAT scan angiography, i.e. the dye test, and an MR angiogram, again, another dye test. They provide detailed pictures, but there's a higher risk, and you better make sure your kidneys are working real well to have those.
All right, so let's talk about standard of care treatment.
Well, first we focus on lifestyle changes. Quitting smoking, exercising, and improving diet and weight loss are big deals. These medications that control cholesterol, blood pressure, and diabetes, for some, are lifesavers because in severe cases, you're avoiding the need to have surgeries, which are called angioplasties or stents or a bypass, for heaven's sakes. These may be needed to restore blood flow if you wait too long.
So in your office, where you do regenerative medicine, what do you do with peripheral artery disease?
Well, the research is ongoing, but the regenerative cells and exosomes are being studied to promote the blood flow. And we can use PRP, which is platelet-rich plasma. It has a potential for wound healing and increases the number of blood vessels that are called collaterals and help us get blood flow around a narrow area. It's still experimental in some stages, but it's full of exciting possibilities.
Peptides?
Peptides can be used for sure. And the way peptides are used is with injections, they can improve the strength of the walls.
All right. So beyond this medical treatment, what lifestyle strategies can a patient do that has peripheral artery disease?
Lifestyle makes a huge difference here. It's a big deal. Patients should focus on making sure everything works. Exercise regularly, especially walking programs. And if you start seeing some swelling, put the legs up. My goodness sakes, it's an easy thing to do. You got to eat heart-healthy diets. It needs to be rich in vegetables, whole grains, and lean protein. Stay away from smoking. Smoke-free is key, and you need to manage your stress, increase your sleep, and both impact vascular health.
What's the long-term outlook for these patients with PAD?
Early detection is key, and if you can find early detection using that ABI, the ankle brachial index, and you can identify it early, it's very good because you can stabilize the patients and get them into an active lifestyle. Untreated, PAD increases risk of heart attack, stroke, and limb loss. Regular follow-up helps lifestyle changes and medical care, which makes it less critical.
All right, let's talk about your mnemonic for peripheral artery disease.
It's a good word. It's flow.
Easy.
Yeah.
F stands for
Foot care, especially check the wounds and keep the feet clean and dry.
L.
Lifestyle changes, quit smoking, exercise, and diet.
O.
Optimize your health with managing your diabetes, cholesterol, and blood pressure.
W.
Is watch your circulation, regular checkups, and that ankle brachial index is easy.
All right. Well, thank you, Dr. Henderson, for guiding us through peripheral artery disease, a condition that can be silent but serious. If you or someone you know has leg pain when walking or slow healing wounds on their calves, don't ignore it. Seek medical advice. Early detection can save limbs and lives. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.